Dr. Rithika. Welcome back to my next video in the series of my fellowship journey. In this particular video, I'll be talking about what cases I got to do throughout this 1 year fellowship course. How was my clinical exposure, what instruments that I had to buy, and how the whole documentation plays an important role in dentistry. So let's get started. So what happens in a day in a fellowship course is that the first half of your day will be for the outpatients. You'll have to finish up the treatment plan. You'll have to enter all their details as well. And in the second part of the day, you can continue with your appointment cases. So that is how it works. And for each and every case, you'll have to take photographs, and documentation and maintaining the patient details is something that plays a very important role. So there will be a set of quota for you to complete in each department, in which at the end of the course you will have to document it in a book. Only then you will be eligible to obtain a completion certificate of the fellowship. And in general dentistry, since it will be a comprehensive clinic, so there will be staffs from each department. So each and every procedure, you'll have a staff near you. They'll help you out, they will guide you, and only with their presence and under their guidance you can finish up a case. So it will be really helpful, and even you can approach them for whatever doubts you have. When it comes to the cases that I got to do in my fellowship, it actually varies from person to person, but we all have a set of quota to be completed. I'll be sharing what are fellowship cases that I got to do in this 1 year journey. And I would say you'll not be allotted only one such particular case. Patient will be allotted to you and you will be their doctor. Okay, you'll be the doctor. So first you'll have to treat the chief complaint for the complaint that they walked into your clinic. And once it is done, you can comprehensively plan the treatment for the patients, educate them regarding the treatments that will be required for them in order to maintain their oral hygiene and their well-being. So likewise, you can complete all of the treatments that will be required for the patients in the next following appointments. So that is how it works. So it not only helps you to do only one particular case, it also, whenever a patient walks in your clinic, you will be able to comprehensively plan the treatment for the patient. That is something by the end of the course you will be very well versed in. You will know what cases that you can do, and also you will know which cases you will need a specialist opinion. You will have to call a consultant. So that plays a very key role, and that is one of the fundamental learning as well. And since it is comprehensive treatment planning and you will be the doctor of the patient throughout for all their procedures, only in certain cases you will need to refer it to the particular department postgraduates with certain if they have certain complications, or if it is something that you feel you cannot handle, and if the staff advises it, then you will have to refer it. Rest, you will be the doctor for the patient. So it will also build your soft skills, where you will have to be the doctor. So you will get the chance to explain everything to the patient. You will have to obtain their consent, and only then you can proceed. So that also plays a fundamental role in improving your soft skills. So it is not just about clinical skills, it's knowing what treatment a patient wants. It's about talking a patient through the treatment. It's about educating the patient, and it's all about working in a team and knowing when to refer a patient if you feel they required specialist care. When it comes to department-wise clinical exposure, I got to do cases in the department of oral surgery, oral medicine, periodontics, prosthodontics, orthodontics, pedodontics, conservative dentistry, and endodontics. And yes, to oral surgery, these are the cases that I did. You can get to do certain cases in conscious sedation with an surgery postgraduate, and with the surgeon and with the surgery staff also. So that gives you even OT experience. When it comes to periodontics, these are the list of procedures that I did, and periodontics will be my favorite, because in my undergraduation I didn't know any procedures apart from scaling, because that is the only thing that I got to do. It will be either hand scaling or it will be ultrasonic scaling. I'm truly grateful to Dr. Priyanka ma'am for helping me through each and every cases. whenever I get a patient, I'll always look if they have pigmentation, if they have recession, and if they have, you know, high frenal attachment. Not only I see in the maxillary region, I also see in the mandibular region. Because of high frenal attachment, most of the patient, they might have recession in their lower anteriors, okay? And also they will complain about repeated foot pouching in that area also. Just a very simple procedure called as frenotomy will really help control the gingival recession also, and the patient can also maintain their oral health comparatively better. So periodontics was something that was completely new to me, and it was a very good experience. Also, I got to work with lasers also. I did cases like laser depigmentation and laser crown lengthening as well. And also you can do frenectomy using lasers also. So it all depends on, you know, what the patient really wants, and patient really wants. If they're comfortable with lasers, you can proceed to it, or else you can do it in scalpel as well. When it comes to periodontics, children who are less than 5 years of age should be referred to postgraduates. Apart from that, you can treat all other patients, and these are the list of procedures that I did. When it comes to endodontics, I was able to complete somewhere around 50 root canal treatments during my 1-year fellowship program. Both anterior and posterior root canals can be done, and everything will be done under rotary endodontic. You learn how to use an endomotor, apex locator, and everything should be done under rubber dam isolation. It is mandatory. Without rubber dam isolation, we cannot document it, and it's not actually allowed. You'll have to do each and every procedure under rubber dam isolation as well. So that will also help you. Initially, though it will be completely new, that is also a kind of learning experience that many might have not had in their undergraduation, because I didn't have. So that was also completely a new experience to me. Apart from root canal treatments, these were the list of treatments that I got to do. When it comes to aesthetic dentistry, there is a special department called a fellowship in aesthetic dentistry. So if you get a case, if you get an anterior class 4 restoration, class 3 restoration, and if the patient has midline diastema, or if the patient has dental fluorosis, or any condition which you think you can treat, what I would suggest is you can go to that particular department. You can go to the department of aesthetics, where you can contact with the aesthetic fellows who are present over there, and you along with the aesthetic fellow can combine, and you can do the procedure for that patient. Why I would suggest this is that only then will be able to know what all instruments the fellowship students in aesthetic dentistry are using. And truly, as I have mentioned, the armamentarium in Savita plays a crucial role, because it helps you to understand what all the instruments that are available in the market, what all the materials that will be available in the market. Only then you will know what to invest and what not to invest, even if you're going to be starting your clinical practice. That plays a crucial role. When it comes to prosthodontics, these were the procedures that I was able to do. And one of the huge shout out to Savita was their telestation lab. For example, once a crown is fabricated, you'll have to check the trial on the patient. You'll have to give it for glazing and all. There you can see, oh my god, it was really fascinating. There were so many dental technicians who were, you know, working on so many cases, and you can get to see the instruments that are used for glazing, and how the glazing is being done, how they are fabricating a framework and everything. Also, they are practicing even digital dentistry, so you can see the treatment plan that is being done on the screen. And I really liked it, and I was able to go to that particular department, see how sandblasting was done, and this was all something that was truly very helpful. And also for the people who want to start up their dental labs also, you can see what all equipments that are being used. Everything is very updated. And when it comes to implant dentistry, like I talked about aesthetics, I was able to place 5 implants. I was able to do only stage 1 implant surgery, along with either a staff present in an implantology department or with a fellow. Huge shout out to Dr. Yash. Dr. Yash, he has completed FGDS implantology. He let me do the procedure while assisting me, and that truly helped me understand how to place an implants. Even if you read it multiple times, only if you place something, only if you actually do the clinical procedure, you will know how it actually feels. So I was able to place 5 implants, and that was a very good introduction for me. I would suggest you always and always have a good network with the fellows that are present over there, and not only in your department, in other department as well. That will truly help you. That will truly help you to learn more. Always be open to learning as well. When it comes to orthodontics, these were the set of cases that I was able to done. We did 4 fixed appliance bonding. I was able to debond 2 of the cases, and really helped me to understand what cases that I can personally deal with, and the staffs will also guide you what to do in the following appointments as well. When it comes to oral medicine, we'll be able to diagnose the cases, and if there is like aphthous ulcer, traumatic ulcer, or a chemical burn, or if there is, you know, any minor oral lesions, you will be able to treat them. And certain cases have to be referred if the patient has lots of systemic complications, and if they require any invasive care, it has to be referred to the department of special care. But the one thing is, the staffs will ask you questions, they will help you out, they will give you an overall they'll give you an overall idea about how we have to plan the treatment, and you can also go and approach them regarding what to do and what not to do. Even if that particular case is going to be transferred to the postgraduate, you can follow up the case, you can also talk with the staff regarding it, or you can also go and contact the postgraduates present over there. And I would say that there are few genuine people out there who will take time, who will be really happy to teach you something. Okay, that's something that you might have never known, and that teaching is something that's going to help you a lot. Okay, so try to network and try to talk with the people out there, so that is how you learn. As I said in the initial part of the video, documentation plays a crucial role. Even if a patient walks into a clinic with the chief complaint of scaling or even a buccal pit, you need to document all the intraoral photographs. You need to document all the details of the patient. So initially, though, it will be something new for us and something that will be time taking, but this is a practice that will truly help you even if you start up your dental practice. Maintaining dental records and having the knowledge to how to obtain consent regarding a certain procedure from a patient will definitely help you stay proactive, and also help you legally as well. So documentation plays a crucial role, so make sure that be ready, be put your time, take proper photographs. That will not only help you to, you know, maintain patient records, but it will also give you the actual proof of having completed all these cases, which will also be, you know, acknowledged by the particular department staff. So it will help you educate the next patient by showing them what treatment you have done, by showing the outcome before and after pictures, and also it will also help you see your progress from the start to end. I would suggest have the basic instrument that you used in your undergraduate practice, and get an iPad with a storage not in 64 GB and all. Have a higher storage, so that will help you maintain the pictures, videos and everything. Okay, and what you can do after joining fellowships, there will be many dealers around you. Okay, there will be many dealers around you, so you can come to the clinic, you can talk with the students who are actually present over there, you can talk with the staff, and then you can decide what brand to invest, what material to invest. That will truly help you a lot. Don't try to buy everything beforehand and come. You will have the time to actually buy, and also, you know, when you talk with other students and when you talk with the staffs present over there, you will really know what all the materials that are out there, what all the armamentariums that are out there, so you can make an informed decision and you can invest on the brands accordingly. There is no restriction, but you need to have these certain set of instruments when you're going to be starting work in your patient. So you will have time before that to buy all these things. The list of instruments that you need will be handed over to you once you enter your clinic. So with that, you can plan and you can buy, you can invest in the brands accordingly. Materials will be provided to you by the institution, for example alginate and all the impression materials and everything. materials that the institution provides is of top quality. So the material knowledge is also something that you can gain through this department. Many people have also inquired regarding the language, and if you're someone who doesn't know Tamil, then it might be a bit difficult for you to communicate with the patient initially. But many of my colleagues were from other states who didn't know Tamil, but they managed it really well. You can get help from the Tamil speaking fellows who are present over there, and over a period of time you can manage it. It's not something that is not manageable. People managed it really well, so that will not be a problem in the long. The final thought, the training truly prepares you for the clinical practice, and you can get a good knowledge regarding all the materials, all the new techniques, and even in the departments like implants, aesthetics, and also regarding laser dentistry. If you're planning to take a fellowship, then come prepared, be open to learning, and make most out of every case. Everything actually depends on you, how you utilize this course, and everything is going to be available, but it's all about you and your determination and the work that you're willing to do. Next video is going to be the real talk, the post fellowship scenario, and how this fellowship has benefited me and what all the difficulties that I face right now. And it's going to be the last video, and I hope you like this video, and if you feel it's informative, do share it with your friends. And I would be really glad at least if one of the person who watches this video benefits from this. If you make the right choice, and maybe if you are a little bit less confused after watching this video, then I would take it as a win. That is the whole intention of this video. So whatever you choose, make sure you put your heart and soul into it, and also make sure that you don't drain your parents wallet. Don't ever do anything for the societal pressure. Do it for you, do it for your betterment. Thank you. I would see you in the next video. Bye.